Today I want to welcome the Minister to the House, and I want to congratulate you on your appointment and wish you the very best in your very difficult position. I very much welcome this bill to the House. It marks another step in trying to achieve the Sláinte Care principle of universal access to care at low cost or at no cost. And it's a great sign of the way this government is going when one of its first bills through the House is to extend access to healthcare. Families all over the country struggle day in and day out, and I know myself, I was glad on a number of occasions over the past number of years that there was free GP care for under fives. I have 4 children, and there can be situations when they all get sick like dominoes, and you spend your few weeks or a month in and out of the doctor's waiting rooms, and really that can put a family under serious financial pressure. You know, you could have 2 or 3 kids in. And that's €150, and then you're talking about antibiotics on top of that. So it's a really huge pressure on a lot of families. And it means families don't have to take a chance. They don't have to take a chance on whether their child will be okay or not. And you don't have to make the decision on whether to spend less on groceries this week or bring your child to a doctor. So too many squeezed families make these decisions every week, and I'm so glad that this phased extension of the free GP care for children will ensure that families don't have to make those decisions. And I also very much welcome the income limits for the over 70s to be extended, as there are many pensioners who are struggling with the cost of living. The cost of living are on the increase, and their incomes are not rising, so this is a welcome respite for many. I also want to stress that, as many of my other colleagues here have mentioned, that GPs are under serious pressure. Anyone that goes to a GP knows that you're going to an overstretched service, and you may need to wait for days to get an appointment, and when you do get an appointment, you could be waiting in line for an hour and a half. So I hope we can work to support the GPs and in the lifetime of this government, and to increase the capacity of GPs. And I would also, like the other senators, welcome this bill, but I'd also like it implemented sooner rather than later. That's a bit selfish, but I am really looking forward to seeing how you progress Sláinte Care in your term of office, Minister, and I look forward to see how you work with the GPs and ensure we have a very functioning and effective primary healthcare system. Thank you very much.